Well, good morning, ladies. Welcome to our session on the Fountain of Youth. I'm really excited to be back at the Women's Health Conference this year. It's been one of my favorite events to speak at for the last several years, and it's mostly because it's rare to get a chance to just talk to women without their annoying and troublesome husbands present. My wife was supposed to be here, so I get to say that. I'm Dr. Gupta. I'm a plastic surgeon at Loma University, and this is meant to be a session truly on the Fountain of Youth. This was Ponce de Leon's vision of the Fountain of Youth. We would all love to experience it. I don't think it exists quite yet, unfortunately. My goal today is to show you some of the types of transformations that can be done with little pain. I heard someone say no pain earlier. It's little pain. So it's gain with little pain, not no pain. And we'll go through her case in a little more detail later. But one of the other things I've noted year after year here is that I get repeat people in our session. So to make it somewhat new, I thought I would add in the top 5 advances of 2014. So we're going to start with that, and then we'll focus in a little more on the gain with minimal pain. So number 5 on my list of great advances in plastic surgery for last year is the introduction of Juvederm Voluma. And this just came out as I was giving this session last year. So we've now had a year's experience with it. This is a brand new filler. People may recognize the Juvederm name, but the Voluma version of it has been available in Europe and parts of Asia for the last 3 or 4 years, but just has been in America now for 11 months. And it is allowing us to make some very nice transformations in faces. It's just volume, but it is volume that seems to hold in place. The clinical trials say 18 months. I have patients now that are in their 12th month since I started injecting them, and it is holding up very well. Can't tell you that whether it'll make it to 18 months or even longer, but it's at least 12 months. And this particular patient had the Voluma added to the cheek zone up here. So I'm sorry, this is the pre-op, of course, added in here. It's something we just do in the office. It's actually a very straightforward procedure, but Voluma has really been a game changer. Chemically, it's the same as the Juvederm and the Restylane and the Perlane that you may be familiar with, but the molecules are packed a little bit more tightly together. I think that's why it stays longer. By having those molecules a little tighter together, it seems to suck a little more water. So all of the fillers work by attracting the fluid. This one tends to hold it a little bit more effectively. So I give that one a thumbs up. That was advance number 5 for 2014. Number 4 is one that I'm increasingly excited about, and that's 3D printing. And we haven't really seen the true impact of 3D printing in plastic surgery, but the concept that was put forth in 2014 was one of making custom body parts. And custom breasts and breast implants has come up where we can create the absolute perfect right-sized implant for women. Unfortunately, the materials that you can print with the 3D printer aren't really very good yet. So I'm giving that one a thumbs down for now. But we are able to use that 3D printer to make print body parts that look very real for patients that have lost them, and we're trying to restore things from cancer, accidents, and so forth. So that part of 3D printing I give the thumbs up to. Advance number 3 in 2014 is a little bit troublesome, a little worrisome. It's this do-it-yourself plastic surgery or do-it-to-your-friend plastic surgery. And I think you've all heard, unfortunately, of what are truly horror stories of patients undergoing injections of various substances. And some of you may know this, but the most common source of silicone in America is Pep Boys, and where it's sold as a lubricant. And unfortunately, Pep Boys silicone lubricant has been injected into humans, and it shouldn't be. And there have been some real tragedies, including 2 deaths in the country. So this is one along with its sister, the Instabreast, or what's known as vacation boobs. That's another one that I'm going to definitely give the big thumbs down to, even though it was very popular in 2014 to talk about it and to present about it. So yeah, that's definitely a thumbs down despite its popularity last year. Number two is something kind of fun that has really taken storm in America, and that's actually my cue. I promised my little daughter that I would take a selfie of myself with the audience. But selfies have done a great thing. You have to be good with your hand to do this. That's right, everybody smile. Let me get out of the light. There we go. Oh, I got that light in there again. Let's see. I'm no good at this. I don't think I can do it with the light. In any case, selfies have been a boon to our specialty because patients are actually coming in. Yes, of course, it triggers your concepts and your ideas and what you see of yourself, but you're actually coming in much more educated because you say, you know what, there's that one line that always happens when I smile right there. And I don't always see it until you smile or until you pull your phone out and you say, see, right there. So selfies have been a thumbs up in 2014 as an advance in plastic surgery. And then that brings us to number one that's top on my list for last year, and that is the real visualization of Ponce de Leon's Fountain of Youth from 380 years ago. It doesn't exist. And nor does this. That's Photoshop. That's Photoshop. But I stick it up there because in the month of December, a team of researchers from the University of British Columbia discovered a gene that produces an enzyme that is found when people are treated for certain types of heart disease to lower their risk, that seems to take away the skin's ability to change when it is subjected to ultraviolet radiation. So when we go in the sun, that's one of our main causes of aging. Somehow getting heart healthy helps you not age as much. So no big surprise in general terms, but this particular molecular-based enzyme that we will start to learn how to develop to control over the next 2 to 3 years is actually a really exciting advance, and it just was published in December, so this is brand new research, brand new science. I'm very excited about it. I know we are going to develop pharmaceuticals around this over the next couple of years, and this will be amazing when it comes out, but that is Photoshop. So I give it a thumbs up, not the Photoshop, the enzyme that we can now block. So what is promised for all of you for this session is your custom facial roadmap, and that's something that we'll see how we do. We have a stack of these down at our booth in the exhibit hall, which is the Department of Plastic Surgery booth. So I don't know if this is something we'll work through as a group or not. I don't know if I'll have a volunteer who wants to be the person who gets their roadmap. But let's talk a little bit about Facial Aesthetics 101, what causes aging, what are the things we can do. And we're really going to focus in on minimally invasive techniques, the things that are the little pain for gain part of this. So there's all sorts of reasons why people age, why their faces age. All three women that you see pictured there are the exact same age, but all have lived a different lifestyle, as you might have imagined. But a lot of things go into aging. And everyone ages. You can be Miss Universe in 1973. Unfortunately, you're still going to age. Aging and the changes that occur in the face have been a focus of research of mine for over 20 years. And here you see one of our sophisticated tools, which is a three-dimensional imaging system that we use to watch where volume changes in people. And this is a mother-daughter combo who happen to look very similar. But it's exactly this sort of analysis that has shown us that what really happens when you age, what is the crucial factor, is actually volume. And that's the fancy name we've given to that is the beach ball theory of aging. Because when you're young, you're a fully inflated beach ball. And unfortunately, some of that air slowly seeps out from about the time, unfortunately, 35 is the cutoff. That's when we start to see less collagen being made than is being destroyed when we live our lives. So the beach ball theory and volume is really a central focus in anti-aging now, and how we control and how we reverse aging as well. So again, a whole bunch of reasons why we age. Intrinsic factors are things that are part of your body. That's the hormonal system, your genetics, your ethnicity. Extrinsic factors are things we're subjected to. And until Richard Branson's space airline takes off, I don't think we're going to be able to combat gravity in any effective way. But sun exposure, you can protect yourself from the sun, and surely no one in here still smokes. But those are some of the things that you really have to avoid. And don't forget stress. 7.5 years apart, before and after. And then, of course, I don't play partisan politics in public. Similar time frame with a little bit of Photoshop help there. Lots of changes occur as you age. I'm not going to go through these in detail. These are very intense anatomic changes that are only depressing to hear about. But in your third decade of life, your eyebrows will tend to start to drop down a little bit. That's the only thing that really happens. Remember, your third decade starts on your 20th birthday. Your fourth decade, starting on your 30th birthday, is when you start to see a little bit of extra skin in the upper eyelid. The fat in your upper and lower eyelids can start to poke through a little bit, and you see small bulges. You can see what we call glabellar frown lines, which are people's 11s, the two lines right here. Those can start to develop in that time frame. And as the cheek starts to deflate a little bit, that's around age 35, these nasolabial folds start to show up as well. Fifth decade, now we start to see the pain. Forehead lines get a little bit deeper. Those furrows in your brow get a little bit of deeper. You start to get crow's feet, and that's only if you're happy. If you're a sad person, you actually won't get crow's feet. You'll get everything else. But you won't get the crow's feet, because that's an expression line. You get that from smiling. And then you will see more skin in your upper eyelids at that point. And then you start to see vertical lines. People call them lipstick lines in your upper lip, where your lipstick can run into that. That's all volume loss. That's all that is. Almost everything here can be attributed to volume loss. Sixth decade, I almost don't even want to get into it, but things just get worse. That's really when the cheek starts to fall down, the neck starts to fall down. It's a sad, sad time for our faces. And then seventh and eighth, we will not cover that. But I am going to give you a trick now. And this is a fun party game you can play. You can tell everybody that you know exactly where the muscles in their face are and exactly which direction their muscles run, because anybody that has a wrinkle on their face has a muscle that runs perpendicular to it. And that's a very easy way to know where the muscles are in someone's face. It's actually true throughout your body, but definitely in your face, when you see a line, the muscles are running exactly perpendicular to that, which for us as plastic surgeons gives us a direction. It tells us what we need to restore, what we need to lift, where we need to fill. So that's the facial muscles. So again, in the upper third of the face, there's some fancy muscles, and these create some very specific lines. And the things that we can do, this young lady had exclusively non-surgical treatments in her before and after. So she has a combination of Botox to her brow itself in this zone here, which knocked out her 11s, knocked out these lines here, gave her a so-called chemical brow lift, which is very effective. She had a lot of laser treatment done here. A lot means 2 or 3. And then we also knocked out her crow's feet. But it really makes a big difference in the eye opening, what would appear to be a much more awake and youthful look. And that's an example of the upper third of the face. Mid-face is a painful area. It's not one that we generally tackle in that same age category. Now we're up into that fifth decade of life when we're talking about the mid-face. And it's all about this cheek coming down. So in the mid-face, we do a mid-face lift. Or, as this patient had, she had a combination of volume with a very, very minor surgical lift. So there's the little bit of pain for significant gain. So she had fat grafting done to cheek regions here, fat grafting into here, fat grafting into here, and a little bit into the lips as well. This gentleman only had fat grafting done. It's not necessarily so telling. He wasn't comfortable with his face being identified, so I've blacked out the eyes. So you don't see the full effect of it, but it is actually a much more youthful appearing look after fat transfer. He had 2 rounds of fat grafting. Oh, yes?
Where did you get the fat?
That's a really good question. You can actually use fat from almost anywhere in the body, but we have found that some places are better than others. This is a male patient. In a male patient, the best fat seems to actually come from the lower back. In a woman, there's 2 areas that provide fat. And when I say the best fat, it's the fat that's going to stay and persist the most. In a woman, it's the little area from the belly button down or the upper portion of the outer thighs. Those are 2 good donor. Don't grab it in public. Come on. Those are good areas to. You have a little bit, and that's enough. And donor fat's a concept that's evolving. The transplantation of fat is probably not even 5 years away. So yeah, there's going to be fat banks. Well, there actually already are fat banks where you can store your own fat, but that hardly seems worthwhile. When you, that's right. But yeah, fat in some parts of the body is definitely better than other parts of the body. But fat does have memory. So if we take fat from the abdomen and you lose a lot of weight after that, you will lose the grafted fat as well. It still continues to behave based on its donor site. So fat grafting should be done when you're at your target weight, when you're at your baseline, not before and not after. Yeah, it remembers. The fat remembers where it's from, and I'm sure it has to do with receptors on the cell. All fat is responsive to hormones, and the fat lives when we transfer it. So I'm sure it has the same signal reception. Lower third of the face. Another sad area, but also one that's in the 5th and 6th generations. You know, it's as gravity takes effect, the changes get more accentuated the lower you go. That does happen to continue below the head and neck area too, as you may imagine. But you have a lot of thinning of the fat. Jowls are a big deal. Jowls are it's actually quite sad to think about jowls because the fat that's here that's creating the jowl actually started up here, and if it were just back where it came from, it would be perfect. And that's not something we can do non-surgically, but it is something we can do surgically, is bring that jowl back up, and it does well. This patient had a very minor local anesthetic neck lift, and then also had fat grafting and also had laser. And it makes a big difference, but that's a big investment of time. That is almost a year in process, to go through all these relatively minor things. She took a total of 7 days out of her life, or off work, I should say, to go through all of the things to get from start to finish. But it can't happen overnight. If you want it overnight, then you're at a commission much longer. So I like to think about it as turning back the clock. So it just keeps ticking. So if you're as she was in her early 60s, and we dialed her back to early 50s, by the time 10 years passes, she'll look just like she did. It's just a matter of resetting things. Keeps on ticking. And this patient had minimally invasive stuff only. It's not a particularly great picture, and it's not a particularly great outcome, but she had volume added strategically to the upper cheeks and the nasolabial fold, so here and here, which corrects the jowls some, tightens the skin some. It wasn't really enough, but some folks only want to feel a needle and don't want to feel the knife, and that's an example of that. So we've just talked about a whole bunch of terms. We've talked about all kinds of procedures and techniques. So I want to give you a little bit of order to that. So this is that girl we looked at the start. So she had a fairly complex sequence of treatments. She had Botox to her brow and her crow's feet. She had chemical peels and lasers to her lower eyelids. And then she had Juvederm placed in her nasolabial fold and a little bit in her lower lip and at the corner of her mouth and she had Voluma in her cheek. So every one of those is a 20, 30-minute office visit. Every one of those is a relatively no downtime procedure. I mean, very few people truly come in on their lunch hour because I'm never running on schedule. But very few people come in on their lunch hour, have something done, and go back to work. But almost everyone does go back to work the next day. The only exception of all the things she had that I generally discourage people from going back to work the next day is laser resurfacing, where I do think you should take 2 to 3 days off, because otherwise you look a little too bright and shiny and red, and that's not a good signature for me. But in any case, those are minor things. So again, lots of concepts, lots of topics. So the options are listed here, and this is what we'll spend the rest of the session talking about. So at the top of the list are skincare, prevention, light chemical peels. These are things that everyone should be doing. Everyone should be protecting themselves. Everyone should be using some agent in their skincare to be turning over their skin a little more aggressively. That's your job. That part's not part of my job. If you want advice on this kind of stuff, see a good esthetician. Our esthetician is here. She's downstairs in the exhibit hall, already overwhelmed, so don't tell her that I told you to go talk to her. But she's a great resource to get you organized towards this process of prevention. And that really should start, oh, I'm sorry, yes, you have a question.
What exactly is a light?
That's a good question. So chemical peels, as the name implies, use a variety of different chemicals, most of which are fruity acids. So we have sour milk acid, which is lactic acid. We have sugarcane acids, and so forth. So there's salicylic, there's alpha hydroxy, there's beta hydroxy. Light chemical peels are peels that only impact the outermost part of your skin. So they are the ones that impact only the epidermis, only the water barrier. They don't go deeply. They don't get down to the level of cartilage. They are collagen, not cartilage. They are designed. Better not be any peel that gets to cartilage. So the light peels are designed to take off the outer layer of your current skin, but they don't necessarily stimulate in an aggressive way new skin to come in. That's a little further down the list. Botox, we'll talk a little bit about where Botox can help. Non-ablative resurfacing, that's a fairly fancy term. Ablation means destruction. So the non-destroying resurfacing type techniques, these are Fraxel type lasers, if you've heard that term, or fractional, which is the version I use, are these minimal downtime lasers where you just have 2-3 days or even as little as 1 day recovery, and you're not taking off the outer layer of skin, but you're stimulating new collagen to come in. They act slowly. This is not something for someone in their 5th decade of life. This is for your 4th decade of life. And that's the continuum here. As you go lower down this list, I should put it actually with the decades of life next to it, because that's almost how it parallels. Then you get to real chemical peels, where you are taking off that outer layer of skin, where you are making an impact on the dermis, or the second layer, and you're stimulating more dermis at that point. Laser resurfacing is even stronger than that. That's the destructive version of laser, where you're actually taking off a layer of skin and allowing new skin to grow in. As we get lower on the list, again, we're also talking about things with a little more recovery time too. And then we come to volume, fat and filler injections. Volume is key. We didn't know this 5 years ago. We didn't know this when I was training, but now we know, thanks to the beach ball theory, that volume is what really matters. We can't just pull skin tightly anymore. We have to reset things like the jowls. We have to add volume in. That's really what anti-aging and looking better is. And then, of course, surgical rejuvenation, things like facelifts, eyelid lifts, brow lifts, and everything else. So let's take a little bit of a deeper dive into thinking about what the right procedure is for you as an individual. So you have to think about how much time are you willing to take out of your life. That's your downtime tolerance. Is it truly just the afternoon you come to see me, or can you squeeze a 5-day long weekend out of it? Can you take 2 weeks out of your life? That is a big determining factor in what you should have done. Then the duration of effect. Are you interested in coming in for very minor things 3-4 times a year, or do you want something that's going to be a little bit more permanent, and then you don't have to come in quite as often? Your Fitzpatrick class is a classification system of your skin pigment, and that's something I can help you with. That's a scale of 1 to 6. I'm a 5 on that scale. African American skin is probably a 6. The palest of the pale is a 1. That's almost albino, and then everybody else is 2, 3, 4. And the higher your Fitzpatrick scale, the less options we have on resurfacing, because our skin tends to scar more when you're my skin tone or darker. Your Glow-Gal level is another fancy scale that we use, and it's one that measures the type of wrinkling that you have. So wrinkles start as just lines that appear when you animate your face, and then some of them, then you get to a higher scale, when a score on that scale when they're present at rest, and then the highest level, which is a Glow-Gal 4, is when all your face is just wrinkles, like that guy in the picture with the muscles underneath. He's a 4 on that scale. And then, of course, what do you want? What are the areas you want to treat? So let's zone in a little bit onto injectables themselves. That's a broad category because people say Botox to mean any time I stick them with a needle, but Botox itself is a neurotoxin. It's used where there's active muscle. Fillers are really as commonly used as Botox and are when we're trying to augment someone's lips, when we're filling in lines. That's really more filler. So those are all categorized as injectables. They're not all categorized as Botox. I never like to hear someone coming into my office for Botox to their lips. It'll make it so you can't eat, so you don't have that. Botox itself is a purified protein. It comes from Clostridium botulinum. The most common source of Botox is actually honey. That's why you never let your newborn babies ever eat honey. That's actually one of the sources of it. It's been used as a cosmetic product for almost 13 years in the U.S. It's actually been used a lot longer than that, but it's been approved for use for 13 years. There's very few side effects when it's done right. Lots of areas respond well to Botox. These forehead lines are a great example of areas that are good to treat with Botox. The 11s, that's another area that does really well with Botox. Injection of that central brow is a very easy treatment. I think an actual Botox injection takes me probably about 2 minutes of actual time when you're actually lying there and everything is set. It's 2 minutes of you feeling a repeated number of little pokes and pinches and crunches, but then it's over. Crow's feet is a great area. Remember those muscles again. Your wrinkles form perpendicular to those muscles. So there's a circular muscle around your eye. So when things get really bad, you can actually have wrinkles around your eye that look like rays coming off of the sun, and don't get that far. We'll stop it in advance. But crow's feet are very easy to treat as well. The platysma is the muscle, which in guys we call it the shaving muscle because you tense it when you're running your razor up and down your neck. But the platysma can form bands in the neck, and when those bands are tight like a guitar string, Botox works, and it's actually very effective for them. It's not good for loose skin, but when you have a tight band in your neck, it's great. This upper patient is a school teacher whose students always thought she looked a little angry. Responded very well to Botox. The lower patient is a used car salesman. You can't believe anything they say, and you can't believe how they look. They're all fake. But anyway, sorry if that's an insult to anyone or anyone that you know. And here's crow's feet in a nurse that works for us who has a very, very nice response in her crow's feet area. Let's switch over and talk about fillers. I have a very strong preference that has been evolving for the past 2 to 3 years now towards using fat. I think that we can achieve more injecting your body's own fat. I think we can get somewhat of a permanent effect, and I think that injecting your own fat actually changes the biology of the skin above the tissues where we put it. So I'm a big fan of fat. Collagen was the original filler, and it became available in the late 1970s. Collagen, in the form that was available commercially, was and is junk, and it's not used today. It's not sold today. It would last sometimes weeks, maybe months, but it left some scar tissue behind, the body's reaction to it. So it was never really a very good filler. It was the only filler that was available when I did my training, but even then we still didn't like it really. Hyaluronic acid is the base filler in many, many, many products. It is what is in Juvederm, it's what's in Restylane, it's what's in Perlane, it's what's in Belotero, a bunch of the trade, and of course Voluma now. So it's really the base product of a lot of them. Hydroxyapatite is the material that our bones are made out of. When you take the calcium out of it, it becomes a white powder that can be used to fill. It's a firm filler, as you might imagine, being the structural component of bone. We use this to fill in skin cancer defects more than I use it to fill in wrinkles. And then we get to the volumizers, and there's really 2 in that category. One is Voluma, which we've already talked about as that product of the year last year. And the other is Sculptra, which is a more intensive product to use. But when you think about fillers and volume, in the ages gone by, stuff like this, could happen. That's an extreme, of course. But there was a real focus on adding volume to the middle third of the face. And that's, I actually call that, and hopefully no one will take offense, I call that the Orange County look. And not just because of the housewives, but that is the Orange County look. There's a lot of volume added right in here, very smooth, and it's truly a characteristic look that you see there. What's really missing is adding volume to the outer third, and Voluma has brought our attention to that broadly, but it's also really where we've always put fat. We use fat, much like in the 70s and 80s, we used to put in cheek implants to lift this skin up. Fat is an implant. Voluma is an implant. We use them to tighten the skin by filling the skin. And again, just think back to the beach ball theory. If it emptied out, fill it back up. So fillers, the synthetic fillers that are available in the US, again, what you see on your left-hand side are the 4 fillers that are commonly made out of hyaluronic acid. Radiesse is that hydroxyapatite filler, and then Sculptra and Voluma, all the volumizers that are used. So what is interesting, why hyaluronic acid makes such sense as a filler is because it happens to be one of the chemicals that we really seem to lose a lot of as we hit that 5th decade of life. In fact, if you can read the numbers at the bottom of the screen, it drops down to about a 20th of the concentration that it used to be in when you're in your 20s and 30s and early 40s by the time you're 60. There's just none left. So replenishing it is a big deal. Now, don't go on Amazon and buy the drink of hyaluronic acid. I guarantee you, you will not absorb any of it at all if you do that. It's just, you can't get it into your body that way. Even when we put it in with the needle, it doesn't stay forever. But it follows that basic concept of replacing like with like. You're missing hyaluronic acid, let's put in hyaluronic acid. This is an example of Perlane added to the nasolabial folds and around the mouth. So this is 2 syringes of filler. This is a 20-minute procedure. It makes a big difference, and in these areas, that's probably about a 7 or 8 month win for her that she'll look that good for.
What's the recovery time
It's pretty minimal. You will be swollen and a little puffy in the areas. Like, for example, for her, because we put a little bit in her lip will stay swollen for a good day and a half. But other parts of the body don't really, other parts of the face don't really swell that much. So if you avoid the lip, you go to work the next morning, you go live your life the next day. There's no real recovery. Could you get a bruise? Yes. Can you come up with a little white lie and say that you went to the dentist? Yes. But that's relatively rare. This is Voluma. So with Voluma, and this is not actually the way I do my markings, but it is similar because we do inject into this zone right here, and we do draw out the bottom of the soft tissue that we want to lift up. This actually comes from the company that makes it, and I don't know why they're drawing on her nose because we're not putting Voluma in the nose. We do fillers to the nose, but not Voluma. But Voluma is also relatively easy to tolerate. It's not a big deal for patients to have it done, and similarly, you'll go back to your life the next day. What about fat? I love fat. I love to take it out, and I love to put it back in. So this is local anesthetic procedures. Here we're taking just a little bit of fat from the side of the hip. We then process our fat in a fairly unique way. Most people will process their fat in some way, but we have some unique twists that we have developed in our lab that seem to make the fat inject more easily for the patient, meaning it's more comfortable, but then also persist a little bit better. So after we separate the fat in a centrifuge, it separates into 3 layers. And we used to throw away this. This was the blood. These were the good cells. And that looks like oil, and it is. It's the ruptured fat cells. But what we've learned now is that at the very bottom, and I don't think you can necessarily see it in the slide. There's a little dark pellet right here. That's something called the stromal vascular fraction, and that is incredibly rich in stem cells. Fat happens to have a lot of stem cells in it. In the United States, we are not allowed to take fat from you, process it, magnify the stem cells, and then put them back into you, though that does happen in other countries. In particular, in Southeast Asia and South Korea, they have very advanced techniques of doing true stem cell facelifts. We can't do that, but the next best thing is for us to isolate that stromal vascular fraction and use that in the most critical areas where we really want to have volume stay, where we really want to change it. So we're using this, for example, of course, in the face aesthetically, but we ended up developing this treating radiation injury in breast cancer patients who have radiated skin and really suffered tight, scarred skin, and we've been able to reverse a lot of those changes with this SVF component of the fat. And that's part of my excitement around fat grafting is just the amazing changes we get with it. Then we put it in different sizes syringes with different sizes needles, and we can put it wherever we want. I used to do fat grafting to the lips. Now we do fat grafting the entire face. We use it a lot in breast cancer reconstruction. We use it in skin cancer reconstruction. We even use it to rejuvenate the back of women's hands. Fat is cool. Fat is really, really effective. Resurfacing, I don't think we'll go into any details here. We touched on this earlier. There's the over-the-counter peels like the salicylics and the lactic acid you can buy in the store. There's prescription-level skincare, which is retin-A-based and hydroquinone-based treatments. Light peels, medium peels, those non-ablative lasers, and then the big guns, the ones that you have a real recovery from. In general, you always want to make sure you're choosing the right procedure for the right wrinkle. So you have to tell me what you want and tell me all those other things like the downtime and the durability and so forth. But make sure before you take the exit for the Fountain of Youth that you have the right surgeon. Go to plasticsurgery.org. That's our National Society's website. Don't go to someone's garage and get the Pep Boy version. Come to one of us and do that. But I think we're running reasonably short on time. We have about 5 minutes, so I'll call it quits there, and we'll see what sort of questions you ladies have for me. Yes. Neck is wonderful, but there are very few minimally invasive techniques for the neck. Sometime over the next 8 months, there's going to be a new product released. It's going to be called Kytura, and it's an injectable drug that we will be using in the neck to blow away fat, but also to tighten skin. And I think that that's going to be pretty exciting when it comes out. But for now, surgery. Yes?
Hyaluronic acid, can you put that like in a?
Cream? Sort of. That's under development right now. I don't believe there's any product right now that works effectively in doing that, but there's a type of chemical called liposomes and liposomal delivery, which you can put on the surface of skin, and it carries the contents of that liposome through the skin. So ironically, that has been developed very aggressively and is very effective in the veterinary world. Not for hyaluronic acid, but for other things such as diuretics and so forth, which the racehorses use. We're going to see that over the next year as well. It might be on the top 5 list next year because that drug is close to coming out.
Can you talk about DermaPen?
Yeah. Oh, I love the DermaPen. I don't know if I was the first American plastic surgeon to have a DermaPen. I bought it in Australia before they came out here. I love the DermaPen. It is a minor resurfacing tool, so it falls somewhere short of a chemical peel, but above prescription grade health care. I think it's effective at stimulating some new collagen, but not gobs and gobs of it. So it's a conservative tool, very safe, very, very low risk. Yes?
Did you say how long the fat injections last?
No, I didn't. And it's here's the answer to that. About 40% of fat graft that we transport stays permanently. The other 50 to 60% goes away, but it's really unclear over what time frame. So I generally have my patients, we make our, what you see is what you get analysis at around 6 months post-fat grafting. And at that point, we typically will decide to do one more round of fat grafting. So it's so essentially the typical patient, we average these up over the last few years, typical patient gets 2.2 fat grafts in my practice. So obviously the vast majority are getting 2, a few get 1, and some get 3. Yes, ma'am.
I have a hole in the top of my nose from cancer surgery.
Mm-hmm.
Now, what do you use in something like that? Will it?
That's actually a good area. If it's a small volume hole, then the synthetic fillers are fine and they work well, but it's something that's only going to last 6 or 7 months. It seems like a long run for a short gain to put fat in there, but if you want a permanent fix, you use fat. Because the fat will also change. That's a scar more than just a cosmetic line or a wrinkle. So we want to change the biology of that skin. We want to make that skin better, and fat will do that where the other things will not. Yes.
What would it cost to have like that Loma injected in your cheeks?
$1 billion. No. Voluma is the most expensive filler on the market. It's the newest. It's the most effective. It has the longest duration. 1 syringe of Voluma is $1,000. My average patient, and remember, we've only had it out for a year so far, I'm using not quite 2 syringes on a typical patient.
And how long does it last?
Well, we're at 1 year now, and it's still holding. The company says 18 months.
So how costly then is the fat graft compared to the?
Almost the same. Most patients will tolerate fat grafting under local anesthesia, and in our practice we charge, and the girls hate it when I give prices because they're always wrong, but it's somewhere in the low 2000s or so.
And that's just for this area?
Oh, fat grafting for me, the process is getting the fat and processing it. Injecting it is the 5 minutes. It's an hour and a half of prep time and 5 minutes. So I don't care how many places I'm squirting it. It's about where I get it from. So, Pam in the back.
Can you speak to the natural collagen that I've heard about?
Yes. So again, everything you put in your stomach ultimately is subjected to acid, hydrochloric acid, which will break those down to their building block amino acids, which are the appropriate amino acids that you want to have nutritionally to then rebuild it back up. But unfortunately, there's nothing particular about what you put in your mouth in terms of the source of those amino acids that makes them more likely or less likely to rejuvenate your skin. Topical, oh, I'm sorry, you're referring to applying it. Yeah, they're great moisturizers, very great, and that's important, but you're not absorbing collagen through the skin, unfortunately. Again, this liposomal delivery system is working. There's actually a liposomal delivery system for Botox that will probably hit the market in the next 2 years as well. So I think all of those are great options. We are unfortunately at the time that I'm supposed to say we're done. We do have a team. My team is here. They're both in the back of the room here, but they're also at our booth downstairs. I would be delighted to meet any of you in our office, as would any of my partners. Please come see us, and we'll be happy to take care of you. Thank you all very much.
Thank you.